Yes, the topic I wanted to speak now is about the place and interest of community participation in the prevention and management of chronic malnutrition among children from 6 to 79 months in the Bulungu Earth Zone in the Democratic Republic of Congo. So as many of us know, the DRC population is estimated to be the 54.88 million. Between 2005 and 2012, the poverty rate was reduced to 64 from a previous of 71%. But this rate remains very high when we compare with other countries. In fact, the country was ranked 176 out of 187 countries in the United Nations Human Development Index in 2015, and its per capita gross domestic product stood at only $442. So these figures reflect a lack of income for a higher standard of living and is indicative of an insecure access to food, healthcare, safe drinking water, and sanitation. The situation is even more accentuated in rural areas, which count for more than 3/4 of extreme poverty. So this indicates that a very significant proportion of the people are not making use of available opportunities and not developing the necessary capabilities to live an active, productive, and healthy life. So tackling malnutrition is among the essential interventions which contribute to a high standard of living. Nutrition and complementary intervention aim at covering the nutritional needs of the population, improving the access to food security, and combating all forms of malnutrition. So the recent survey conducted in 2013 and 2014 indicates that the stunting among children has remained the same since 2001. So it's about 43%. So these figures show that the total number of stunted children in DRC is about 6.3 million. So an integrated approach has been designed that would tackle this high rate of malnutrition and lead the people to live healthy and productive lives. This integrated approach includes activities at the health centers level with full participation of community members and includes community initiatives. So health centers level activities consist of child growth monitoring, nutritional advices, the vitamin A supplementation, micronutrient powder supplementation, iron for pregnant women. So they are implemented in the so-called Revitals Health Zone. However, the package of community activities, including growth monitoring, AMCI, family kit distribution, wash practices, and food security activities, are most neglected. And studies have shown that the integrated approach with full participation of community will bring better results in addressing underlying causes of malnutrition. Indeed, from January 2015, Bulungu Health Zone has implemented the full community participation in nutrition activities, and it is important to demonstrate the beneficial effects of this package in Bulungu Health Zone in order to be able to use it as a promotional tool targeting other health zones in the Democratic Republic of Congo. So what we have done, I want to go fast. For our study, the population that have been under our study is children from 6 to 59 months, and we compare data from 2014, the year before the implementation of this integrated approach, and to data from 2015, the year where the approach was integrated in the Earth Zone. The sampling method of our study. So the study was the retrospective one, comparing the Bulungu Health Zone indicators of the medical components before and after implementation of community activities related to the fight against malnutrition of children under 5. To do this analysis, we consider the data, as I said, for 2014, and we compare them to those for the year 2015. The data used for the study came from 2 sources. We reviewed documents and also we conducted focus group. The collection, we had a template that helped for collection, and the process, the analysis was done by using the Excel software, and the minimum significant differences between figures were calculated using the SS program. So in conclusion, what we have found is that based on that analysis and focus group that we directed, we have come to this result that community participation is the foundation for improving health services that have an effect on nutritional status of children under 5. And also we observed that during the implementation of the project that put the community at the center of the activities of the health area, there was a good improvement of key indicators of a good nutritional status. This result shows that community involvement plays an important role in the use of health services, which have an effect on health indicators. The strong involvement of the community workers is demonstrated in the improvement of some health indicators, such as an average of 98% of community workers have been involved in the health activities every month. Almost 99% of the respondents confirmed that they had been encouraged to use health services following the activities of the community workers through sensitization, home visit, case orientation to the health center, encouragement to have a home garden crops. It was observed that 4 indicators out of 14 did not show a difference between 2014 and 2015, particularly with regard to the completeness of the immunization schedule, attendance at prenatal consultation, the vitamin A supplementation at first contact, and number of children born with a weight less than 250 kilo. Sorry, 250 grams. Indeed, these indicators are the elements of the service offer and are not influenced at all by community actions, because there are many factors related to this. In particular, the availability of inputs, so vaccines and vitamin A, the presence or not of a disease in the pregnant woman. For the factors with significant differences, it is clear that the community volunteers have been active in raising awareness, referencing to health facilities, and carrying out community activities, such as early detection of malnutrition cases, culinary demonstrations, villages sanitation, and the promotion of other essential family practices. And when health facilities work in close collaboration with the community, the results are convincing. It is therefore important to revitalize all these bodies of community participation in order to improve the demands of effective use of these activities. This great challenge that remains is the sustainability, because the community is well motivated with the presence of an NGO. And when this NGO left the health zone, so all communities, they become discouraged. Thank you for your attention.